Long before the world awakes,
On the van, I grabbed 2 bottles of the methadone.
the work gets underway for Neville Johnson.
So everything is just ready?
Yes. How you doing this morning? Good. How are you this morning? Good.
And once he has what he needs, the journey to administer life-saving medication can get rolling.
And we're off. I was hired for this position.
John Hayes does not mind waking up at 4 in the morning. There's no traffic, and he always seems to catch the sun just right.
It's quite amazing the amount of people that have the problem that we serve.
John is behind the wheel of a 27-foot-long converted RV. On this particular morning, making his way from Providence, Rhode Island to Woonsocket, about 30 minutes away.
And that's where we stop.
A community with some of the highest opioid use rates in this tiny state.
They're just nice people that hit a bump.
Good morning.
It does not take long for patients to arrive.
Ready when you are.
Raul Rodriguez was addicted to drugs for more than 20 years.
Does it mean you're more likely to get treatment because it's here?
Yeah, definitely.
Until a few weeks ago, he would have had to drive 30 minutes to get the methadone treatment he needs to get better. But now, this first-in-the-nation mobile methadone clinic is bringing the medicine to him.
Oh my God, that's wonderful. I live right the corner. Yeah, and I used to drive like 25 minutes to Pawtucket.
So you don't have to go someplace else now to do this?
No, just right here.
Substance use disorder or addiction, opioid use disorder, is just a disease of the brain.
Linda Hurley is the president of CODAC. They own and operate this mobile medical unit, which a few weeks ago received DEA approval to dispense methadone. Methadone is a medication used to help people reduce or quit their use of heroin or other drugs.
All right, bud, take it easy, be safe.
So it took us a very long time to get started.
Aside from the convenience, this is a cost-effective way for treatment centers to operate. Instead of $4 million for a new building, CODAC spent $400,000 on this RV.
This is a highly effective, efficient, and kind way to provide care for individuals that are dying.
This type of innovative methadone treatment couldn't come at a more critical American juncture. In 2021, an estimated 107,000 people died of drug overdoses in this country. 75% of those deaths involved an opioid. But only 18% of people with an opioid use disorder received medication as treatment. There's another layer to all of this. It's keeping patients from having to go to a traditional doctor's office setting, which comes with its own set of stigmas.
You don't need to come to the clinic to get good care, and healthcare doesn't have to be this scary thing.
As a physician who specializes in addiction medicine, this is a new frontier for Cara Zimmerman.
This is definitely meeting someone where they're at.
Not only is she able to offer patients methadone treatment, she can offer wound care or write a prescription, helping people avoid a costly trip to the ER.
This is kind of more, hey, we're here, and we're coming to you on your schedule, and whatever, as much or as little as you need.
Communities across the country are visiting here to see what's working.
And what would you like with that, juice or water?
As more treatment centers apply for DEA approval to get other mobile methadone clinics rolling nationwide.
And they want to see how we do it, what the barriers and challenges were.
Timing is also a critical component of all this. The mobile medical unit arrives at 5:30 each morning by design.
A lot of them are just regular people. They're coming in early so they can go to work. You know, that's why we open at 5:30. They're coming in before their day starts to get their methadone so they can go to work and live a life.
At the beginning, middle, and end of the day, the ultimate goal here is to help anyone on their road to recovery,
Take it easy, good seeing you.
wherever that road may lead. In Woonsocket, Rhode Island, I'm Chris Conti.